lateral Tarsorrhaphy stitch. I'll spell it here in the bottom caption. But that's where I put a temporary stitch that partially closes the eye. It basically works as a little suspender or support system that holds the eyelid up the first several days when all that swelling's going on. It makes the eyes look a tiny bit smaller during the healing phase. It does not leave any mark. We take them out and your eyes go back to their normal shape and size, but it's basically a safety mechanism in certain patients during that high risk period. A temporal Tarsorrhaphy stitch. This is something I've not discussed before, but it's something that I did today, so I thought it would be relevant. When I do lower eyelid surgery, I personally almost always make the incision on the inside of the eyelid in that pink part. The reason is because we want to preserve the upward stance of this lower lid. We want it to stay upright against the eyeball. We don't want it to get saggy and droop or to form scar tissue and pull down. This is something called ectropion. It is a potentially devastating complication of lower eyelid surgery. So, most surgeons will make an internal incision to access the lower eyelid fat pads, which significantly reduces the risk of that complication. And this is where it gets a little nuanced. So when I am doing just lower lids in a patient who has a lot of birthdays and who has a really flat cheek, something that we call a negative vector, this lower eyelid has lots of loosey-goosiness. And so after eyelid surgery, when you swell, after the laser, the fat grafting, the lower bleph, I don't want there to be extra weight from the swelling that pulls all this down. Now, I say there's nuance here because that's when I'm doing lower lids in isolation. If I'm doing lower lids with a facelift, I often feel like the actual mid-facelift supports the lower lid so much that I almost never think about a Tarsorrhaphy stitch. But today, she was not having her face lifted and hadn't had her face lifted. She was in her upper 60s and so had significant laxity here, also had a pretty flat cheek that really didn't support the lower lid. So I placed a temporary